Examination of the trachea. Inspection. Position of trachea. Observe the position of trachea, whether it is placed centrally or deviated to the left or right. Tracheal sign. It is the undue prominence of the clavicular head of sternomastoid on the side to which the trachea is deviated. The pretracheal fascia encloses the clavicular head of sternomastoids on both sides. When the trachea is shifted to one side, the pretracheal fascia covering the sternomastoid on that side relaxes, making the clavicular head more prominent on the side of tracheal deviation. Palpation of the trachea. The position of the trachea is confirmed by slightly flexing the neck so that the chin remains in the midline. Feel for the trachea by putting the index and the ring fingers of the examining hand on each edge of the sternal notch and use the middle finger to assess whether the trachea is central or deviated to one side. Slight shift of the trachea to the right is normal. The trachea is pushed to the opposite side in conditions such as pleural effusion, pneumothorax, tumors such as lung cancer and associated malignant pleural effusion, lymphoma, mediastinal masses, lymphadenopathy, thymic tumor, etc., and goiter. The trachea is pulled to the same side in conditions like fibrosis of the lung, for example, due to tuberculosis or prior radiotherapy. Collapse of one or more segments of the lung, for example, due to infection or bronchial obstruction by tumor. The trachea may be shifted to the same side in the presence of pleural effusion in the following conditions. Occasionally, in a patient with lung cancer and a large malignant pleural effusion, there will be such severe collapse of the underlying lung on the same side due to bronchial obstruction by tumor that the tracheal or mediastinal shift will, paradoxically, be towards the side of the effusion. Other causes include mesothelioma, empyema or effusion following pre-existing fibrosis. Tracheal tug, Oliver's sign. This sign is elicited by standing behind the patient. The chin of the patient is raised, and the cricoid cartilage is held up on deglutition on either side with fingers of both hands. The sign is said to be positive when a downward tug is felt by the fingers during cardiac systole. This sign is present in aortic arch aneurysm. False positive sign may be due to mediastinal tumor attached to aortic arch. False negative sign may be due to non-pulsatile aortic aneurysm when thrombosed. Inspiratory tracheal descent. Tracheal descent with inspiration can be seen in the suprasternal region in chronic obstructive airway diseases and is known as Campbell's sign. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.